Hey everyone, this is Dr. Amar from Elite Orthodontics, and today I want to talk to you about a complex adult case where there's a crowding, biter problems, and profile concerns. How do we address those cases with collective decisions? Here what we're going to show you in this case. Here you can see my patient's profile. Her lower lips are a little bit pushed forward, and we can see that her lower jaw is slightly forward, so she's a very minor skeletal class 3. And she has the same situation dentally, so she has underbite tendency with some anterior crossbites. Here we can see the underbite. Again, it's dental / skeletal situation. And we can see the first molar has a huge cavity. Here we can see the crowding of the lower arch. We can see lower left canine pushed lingually. We can see cavities on the first molars, and we can see wisdom teeth there. Here is the upper arch, and it seems that this patient was prophylactically got some driftodontics when she was younger, that the bicuspids, both bicuspids on the top were removed, and that kind of enabled her to get less crowding. Here I'm back to the panoramic x-ray, and I want to kind of point a couple stuff in this x-ray. Now, if I think as a classic orthodontist, a lot of the time, they will consider removing 2 lower bicuspids to match the top. And then they would remove wisdom teeth. But in this case, we're looking at the top. Wisdom teeth are already in a good place. So it's an optional for the patient whether they want to remove them or keep them. And in the lower arch, first molars are compromised. The lower right molar, number 30, severely compromised. And the left one has a significant cavity as well. So between this and removing bicuspids, I would choose to remove the molars. And in this way, the patient will finish with a class 1 canine, perfect class 2 occlusion on the posteriors, and never need to deal with an implant on first molars. So collective planning is very important. I see those cases daily where a patient like that, the general dentist already take action with making part of the plan and then hand it to the other specialist, orthodontist, periodontist, oral surgeon. I think in those cases, a multidisciplinary and interdisciplinary diagnosis and treatment plan has to be done prior to actually execute a treatment plan for the patient. That's what we learn in a case like that. Now I'm going to show you the progress photos for the patient. Here I wanted to point the differences during progress of the treatment. As you can see, upper arch is technically just an alignment situation, but on the lower arch, as you can see below, that we remove this molar number 30 and we remove number 19 and we close in the space. In this way, we're taking care of the crowding. We're keeping a good number of teeth on the bottom without needing implants, and we're gonna jump the bite from class 3 to class 1. And in this couple pictures here, you can see that the lower left canine didn't have a space before, and now it's having a space and pushing buccally, and we were utilizing all the space closure for the first molar. So the molar you see in the back right there is the second molar right now. Now, question people ask is that going to be tipping, or are you going to be able to control the space? It is totally fine. You can always control the space closure with tipping your molar's roots mesial more than you tipping the crown mesially. So that's a problem that I hear sometimes orthodontists say that they cannot control. It's actually controllable with a bracket position, wire bending. And here we could see profile change. And again, it's very minor, but you can tell that the lower to upper lip relationship is a little bit better in the progress picture below than the start picture. Thank you and enjoy the day.